Surveillance video from inside a Michigan jail shows an inmate giving birth on the floor of her cell after she claims her request to go.
In August of 2023, a woman named Alicia Moulton was arrested outside a Walmart in Tennessee. The charge was shoplifting trash bags. She was booked into Montgomery County Jail and tested for pregnancy. The result came back positive. She had no idea she was pregnant. Over the next 8 days, she received no ultrasound, no prenatal vitamins, no doctor's appointment, and no pain medication of any kind. On the morning of August 27th, she began experiencing contractions. She told a nurse that something was wrong. The nurse looked her in the eye and said she was not having contractions, that she was too small, and that the baby was too high. While medical staff left the unit to consult with a doctor, Moulton went to the toilet in her cell. She pushed. She could feel the baby's hair. She delivered her son alone into the toilet bowl in a jail cell. The baby landed in dirty water and hit his head on the metal seat. She pulled him out and thought he was dead. He was not dead, but he contracted a blood infection and an eye infection from the conditions of his birth. 2 days later, Alicia Moulton was discharged from the hospital and returned to that same jail. Her story is not an outlier. It is a pattern. Every year, approximately 2,000 babies are born to incarcerated women in the United States. In 2023 alone, 665 live births were recorded in American prisons, and that number only accounts for state and federal facilities. It does not include the thousands of county jails across the country where most of these emergencies actually happen. A joint investigation by NBC News and Bloomberg Law analyzed federal civil rights lawsuits filed between 2017 and 2024 and found at least 54 pregnant women or their families alleging severe mistreatment or medical neglect behind bars. Women gave birth into cell toilets. Women gave birth on filthy jail floors. Women gave birth completely alone while their emergency intercoms went unanswered. In Louisiana, a woman in active labor was told by a jail nurse to shut up and go back to her corner. She gave birth on a toilet. In Mississippi, a 37-year-old woman died of a ruptured ectopic pregnancy after complaining about abdominal pain for days. In California, a correctional officer transporting a woman in premature labor to the hospital stopped at a Starbucks on the way. The baby died. In 2025, United States Senator John Ossoff opened a formal investigation and uncovered what he called pervasive abuse of pregnant women in prison, including women shackled around their stomachs, women forced to undergo cesarean sections against their will, and women who delivered babies into toilets while security cameras recorded everything and no one came. This is what actually happens when a woman goes into labor behind bars in America. From the first contraction to the moment they take her baby away. To understand how this keeps happening, you need to understand the scale. More than 200,000 women are incarcerated in American prisons and jails right now. The United States incarcerates women at the highest rate of any country on earth. Since 1980, that number has increased by 742%. 3/4 of those women are of childbearing age. 2/3 are mothers. Researchers estimate 55,000 pregnant women are admitted to jails every single year. The average jail stay is 26 days, which means many will still be pregnant when they are released. But some will not make it out in time. Here is the part that should disturb you. Most of the women in these lawsuits were not arrested for violent crimes. They were arrested for probation violations, shoplifting, drug possession, petty theft. Some were held simply because they could not afford bail. In some cases, bail was set as low as $125. That is the distance between giving birth in a hospital and giving birth alone on the floor of a county jail cell. And until 2024, the federal government did not even count them. The Bureau of Justice Statistics collected data on deaths inside American correctional facilities for decades, but it never collected data on births. The first federal report on pregnancy outcomes in prisons was not published until April of 2025. A reproductive justice research group at Johns Hopkins put it plainly: women who do not count do not get counted, and women who do not get counted do not count. So, what actually happens when a pregnant woman enters the system? On paper, there are standards. The American College of Obstetricians and Gynecologists says incarcerated women should receive pregnancy testing at intake, prenatal vitamins, proper nutrition, screenings for substance abuse and depression, regular prenatal appointments, and delivery in a licensed hospital. The National Commission on Correctional Health Care recommends ultrasounds for women unsure of their due dates. These standards exist, but almost none of them are enforceable, and compliance varies wildly from facility to facility. At least 9 states, including Hawaii, Iowa, and Maine, require zero training for jail staff on how to handle a pregnant inmate. Zero. Some jails have openly admitted during litigation that their medical staff had no training on pregnancy or childbirth at all. Many jails do not employ their own doctors. They outsource medical care to for-profit companies, and those contracts sometimes include provisions requiring the company to find cheaper treatment options, including using telehealth instead of in-person visits and limiting when a woman can be sent to a hospital. Reproductive health care inside many of these facilities has been described by investigators as basically non-existent. Women report receiving no ultrasounds, no vitamins, no prenatal appointments, and no accommodations for their pregnancies. When they complain, they are dismissed. Tiana LaBoy was incarcerated in Connecticut when she started experiencing labor symptoms on February 9th. She told correctional and medical staff she was in pain. They gave her a heating pad and told her to lie down. For 4 more days, she continued to report symptoms. For 4 more days, she was ignored. Then she began bleeding while sitting on the toilet. She called for help. Nobody responded. Security camera footage from that day shows her placing a t-shirt between her legs and grasping the prison walls just to stay upright. She gave birth into a prison toilet. Her mother testified before the United States Senate about what happened. She told lawmakers her daughter felt like a caged animal throughout her pregnancy. This is not a handful of bad actors. This is a pattern built into the structure. An emergency medicine doctor at the University of California, San Francisco, reviewed the findings of the NBC investigation and said what it shows is, we do not see these people as human beings. An attorney who has represented incarcerated women for 20 years said when staff see their patients as inmates and not as patients and as mothers, this is the result. And when the labor starts, it gets worse. Most correctional facilities in America do not have on-site obstetric care. That means when a woman goes into labor, she has to be transported to a community hospital. In theory, this should be straightforward. In practice, it is anything but. Women in labor are routinely transported in physical restraints, handcuffs, leg irons, waist chains. A national survey of nurses who had cared for incarcerated women found that 83% reported their patients were shackled some or all of the time during hospitalization. Not during transport, during hospitalization, during labor, during delivery. In 2022, states have passed some form of legislation restricting shackles during pregnancy. The Federal Bureau of Prisons officially banned the practice in 2018, but reports from the American Civil Liberties Union and Amnesty International confirm that these laws are not consistently enforced. In the remaining states, pregnant women are regularly chained to hospital beds by the ankle, the wrist, or both while they are in active labor. Senator Ossoff's investigation found women who had been shackled around their stomachs despite the practice being widely illegal. The American College of Obstetricians and Gynecologists has called shackling demeaning, rarely necessary, and a direct compromise to health care. The medical risks are documented. Increased chance of falls, placental abruption, poor circulation, blood clots, delayed emergency response, interference with normal labor, interference with bonding between mother and child, and the security justification does not hold up. In the entire recorded history of American corrections, There are 0 known escape attempts by a woman who was unrestrained during childbirth. 0. Even when a woman makes it to the hospital, the conditions of her delivery are unlike anything a free person would experience. In most facilities, an armed correctional officer is stationed inside the hospital room during labor and delivery. Not outside the door, inside the room. Nearly 1/3 of facilities do not even require that officer to be female. A woman in the most vulnerable moment of her life gives birth without family, without friends, without emotional support, but with an armed stranger watching from a few feet away. Medical records documented cases where mothers were restricted from holding their own baby, restricted from breastfeeding, and restricted from taking a single picture of their newborn. In Georgia, a woman named Jessica Umberger testified before the Senate that she was forced to undergo a cesarean section against her will and was then billed for the procedure. But some women never make it to a hospital at all. The investigation found case after case of women who gave birth inside their cells because help simply never arrived. They pressed emergency buttons that were not answered. They screamed through cell doors and were told to be quiet. They reported labor symptoms and were accused of drug-seeking behavior or faking it for attention. "Nobody believed me," Alicia Moulton said. In Florida, a woman gave birth 3 months premature inside a jail cell. She held her baby through the night. The baby turned blue and died in her arms. That baby's name was Ava. A bill called Ava's Law was introduced in the Florida legislature to require pregnancy testing, data collection, and the option for judges to delay incarceration for pregnant women. It was withdrawn. It has been introduced at least twice more. Each time, it has failed to pass. And even when both mother and baby survive the delivery, what happens next may be the most devastating part of the entire process. In most states, an incarcerated mother is allowed 24 hours with her newborn in the hospital. Some states allow 48 or 72 hours. Then a relative arrives, or a social worker arrives, and the baby is taken. The mother is placed back in restraints and transported to the facility. For 85% of incarcerated mothers, this is the first time in their lives they have ever been separated from one of their children. There are programs designed to prevent this. They are called prison nursery programs, and they allow mothers to live with their newborns in dedicated units inside correctional facilities. As of 2023, only 10 states and the Federal Bureau of Prisons offered them. Missouri became the 11th in 2024. The oldest prison nursery in America has been operating at Bedford Hills Correctional Facility in New York since 1901. In Washington State, a child can stay with the mother for up to 3 years. In South Dakota, the limit is 30 days. But here is the number that matters. In 2023, there were 665 live births in American prisons. At the end of that year, only 86 women were participating in a prison nursery program. 665 births, 86 spots. The rest of those mothers said goodbye. A study at the Nebraska Correctional Center for Women found that mothers who participated in a nursery program had a recidivism rate of 9%. Mothers who were immediately separated from their newborns had a recidivism rate of 33%. The programs work. They barely exist. And the separation is only the beginning of what a mother stands to lose. Under the Federal Adoption and Safe Families Act, parental rights can be terminated if a child has been in foster care for 15 of the previous 22 months. Many women's sentences exceed that timeline. Incarcerated mothers are 5 times more likely than fathers to have their children placed in foster care, and significantly more likely to have their parental rights terminated entirely. Less than 1/3 of children are cared for by their father during the mother's incarceration. Most end up with relatives or in the foster system. Then there is breastfeeding. Federal law says incarcerated mothers are entitled to pumping breaks 3 times a day, but there is no federal law requiring facilities to provide pumps or storage. In states without nursery programs, Infants are typically not allowed to be breastfed even during visitation because of no contact rules. The mother produces the milk. The baby is somewhere else. And forced early weaning is not just an inconvenience. Medical research links it to increased risk of breast cancer, ovarian cancer, diabetes, and heart disease. The question is whether any of this is going to change. Incarcerated mothers experience postpartum depression at significantly higher rates than women in the general population, and the system offers almost nothing to address it. Children who are separated from their mothers at birth show higher rates of depression, anxiety, and learning disabilities compared to children in nursery programs. One incarcerated mother in Indiana described the experience in a way that has stayed with researchers who study this issue. She said pregnancy is supposed to be happy, and prison is like the closest thing to dying. There are people trying to change this. Congresswoman Sydney Kamlager Dove has been working since 2023 to pass the Pregnant Women in Custody Act, a federal bill that would require data collection, staff training, and restrictions on solitary confinement for pregnant women. Colorado passed a law allowing judges to offer alternative sentences to pregnant defendants. Doula programs now operate in at least 6 states, providing emotional support and birth education to incarcerated mothers, and research shows they improve outcomes. But these are pockets, not systems. A sheriff in Virginia said it clearly. Most jails in the country are not equipped and are not trained to handle most pregnant women. Jail is not the place for them. The American prison system was designed for men. Over 90% of inmates are male. The rules, the architecture, the medical infrastructure, the restraint protocols, all of it was built around male bodies. Women were an afterthought. Pregnant women were barely a thought at all. The result is a system where for-profit medical contractors have incentives to cut costs, where no national standard exists for treating a pregnant inmate, where no jail is required to report how many women give birth inside its walls, and where a United States Congresswoman felt the need to say there is no reason I should ever read a story about a baby who was born in a toilet of a jail cell. And yet, she keeps reading them. Follow the timeline. One more time. A woman enters jail, often for a charge that would not make the evening news. She may not know she is pregnant. She may receive no prenatal care. When labor starts, she may be ignored for hours or for days. If she is taken to a hospital, she may be shackled to the bed. An armed guard may stand in the room while she delivers. She gives birth without her family, without a friend, without anyone who knows her name outside of a case number. Within 24 to 48 hours, the baby is taken away. She is placed back in restraints and returned to a cell. The clock starts on whether she will ever see that child again. In most states, she cannot breastfeed. In most facilities, she will receive no postpartum mental health care. And until 2024, the government did not even bother to count how many times this happened. That is how a woman gives birth inside the American prison system. Not because anyone designed it this way on purpose, but because no one designed it for her at all. If this changed the way you think about what happens behind the walls of American jails and prisons, subscribe and turn on notifications so you do not miss what we cover next. Tell us in the comments. Should pregnant women be in jail at all?